from the Warner Brothers Studios.
Hi everyone, welcome to the Becca and Sarah show. Today we're going to be interviewing a physician about his experience with occupational therapists. Stay tuned. Everyone, please welcome Dr. Brilliant. Thanks for being here.
My pleasure.
This is Sarah.
Hello.
And I'm Becca. We're
Nice
gonna
meeting you.
ask you some questions today. How are you doing?
I'm great. How are you guys?
Good.
Wow. Are you having a good day?
Yes.
Yeah.
Awesome. We're really looking forward to having you. And
It's my pleasure.
we're gonna get started with some easy questions, and then we'll move on to some harder ones. Are you ready?
Fire away.
All right. Okay. Dr. Brilliant, can you tell us where you work?
I work in downtown Los Angeles. I'm part of a multi-specialty physician group. It's called Pacific Alliance.
Great. And what's your title?
I'm a gastroenterologist and hepatologist. So I focus on digestive and liver diseases.
Nice. What population do you primarily work with?
So I only see adults, so 18 and above, male and female, from college students till the elderly.
Okay. And you said you worked with patients with liver problems?
I see patients with liver diseases, with gastrointestinal disorders, with swallowing difficulties, with various autoimmune disorders like the inflammatory bowel diseases such as like Crohn's disease, ulcerative colitis. You see a lot of patients with basic digestive problems like constipation, diarrhea, acid reflux, and sort of the whole spectrum of gastrointestinal disorders.
Okay. In order to be a gastroenterologist, what kind of licensing requirements did you have to receive?
So you have to graduate from a accredited medical school. You have to do a 3-year residency in internal medicine, and you have to become board certified in internal medicine. And then you have to do a 3-year fellowship in gastroenterology and hepatology, and you have to take a licensing board exam once you finish your fellowship.
Okay. And why did you select this specific specialty?
I was drawn to the mix of cognitive and manual skills, procedural skills. Additionally, we saw a whole spectrum. We see young and old. It lends itself well to both outpatient care and inpatient care. Pigeonhole yourself into one area.
Nice. Okay. And what potential settings are there for employment in your area?
You can work for like a large physician group, like I do. You can work for a hospital. You can be at a large academic center. You can do basic research. You can do clinical research. You can sort of set up your own shop and be a private practice. There's a whole range.
Okay. Great. And I know you talked a little bit about your scope of practice, but was there anything else that you wanted to add to that?
I can give you an example of like a typical day.
Yeah. That'd be great.
Usually I start around like 7 a.m. and I'll do some hospital rounds. So I'll see patients that are hospitalized that require like a consultation in digestive or liver diseases. That'll be for like probably about an hour, and then I do procedures usually from like 8 to like 11 a.m. It'll be patients in the hospital that require procedures, and patients that I've seen in the office that we book for procedures. And then I'll typically do like an afternoon session in the office from like 1 to 5, seeing like outpatient referrals.
Cool. So you work in a hospital and in your office.
Yes.
Got it.
Question. So for procedures, what kind of procedures do you perform? Like, for an example, just give an example.
Sure. We also do like upper endoscopies, which is an examination of the inner lining of the food pipe and the stomach and the first part of the small intestines. This is for people that are having abdominal pain. We want to make sure they don't have an ulcer. It's also for people that are having some swallowing difficulty. We can make sure they don't have, a mechanical obstruction in the esophagus or various other disorders that can lead to swallowing difficulties. We also put in feeding tubes, and for example, someone that's had a stroke and is no longer able to swallow safely, we can put a plastic tube directly into the stomach where they can get liquid nutrition directly into their stomach, bypassing their swallowing mechanism.
Awesome.
So we do.
That sounds really interesting.
Yeah.
Well, now we're going to move on to talk about some interdisciplinary stuff and what other professions you work with. So I'm going to pass it over to Sarah.
Awesome. So you say that you do a lot of swallowing and feeding procedures, correct? Or you work a lot on the side of them?
Yeah,
Okay.
it's a big part of what we do.
Yeah, so I'm not sure if you know this, but OTs, that's kind of in our scope of practice to work with a lot of swallowing and feeding. So, funny question. I want you to describe what you think OT is.
I think of OT as dealing with like fine motor skills,
Mhm.
and in med school, they kind of describe to us as two broad categories. We think of physical therapists as working with the lower extremities, and
Mhm.
OTs working with the upper extremities.
Mhm.
I think that's a broad oversimplification, but that's kind of always stuck in my mind.
Yeah.
When patients have had a stroke and they're having difficulty with fine motor coordination, and they're trying to regain that muscle memory and that muscle strength, that's what I think of OT.
Awesome, awesome. Well, that's pretty much a good sense of what we do. We do a lot of other things as well. We work with a lot of pediatrics, a lot of with their sensory and their behaviors and stuff like that. So our scope is really broad. So that leads me to my next question. So in what areas have you worked with OTs?
In my residency training, that's probably the phase of my career where I had the most experience working with OTs. We would have daily interdisciplinary team meetings on medical rounds,
Mm-hmm.
where we'd meet with physical therapists, social workers, nutritionists, occupational therapists, the primary care physician, and the various specialists, and each person would give their sort of input on the patient's care, with an eye on coordinating the discharge and the after hospital care plan.
Okay.
I remember working with OTs when I was rotating on the neurology floor, during residency for a couple of months, and we were dealing with patients that were hospitalized after having an acute stroke.
Mm-hmm.
It often we would have to get daily updates from our physical therapists and the occupational therapists about what kind of facility we think the patient could be discharged to, what kind of rehab they're going to need once they're out of the hospital, and working with the families too to see what kind of help we can get them at home. It was mostly in the setting of neurological disorders
Mhm.
that during my training as an internal medicine physician, that was my main exposure to occupational therapists.
Okay, awesome, awesome. So, with that being said, do you have a certain experience that you had, maybe a moment where I kind of need an OT, or do you think that there's a future experience that you might have that you might think, oh, I might need to refer OT to? Do you have any relations with that?
Yes. A lot of times we'll get called in the hospital as a gastroenterologist for someone that's losing weight,
Okay.
and they want us to get involved to see if there's any digestive issues. And sometimes we'll do our evaluation, and we work with a speech language pathologist to see if they're having any sort of oropharyngeal dysphagia, once I'll get a bedside swallow leave, I'll call one of the speech pathologists that we work with, and she'll tell me if everything's okay with the swallow function or not, and sometimes we get these evaluations, we see patient's swallowing okay. I do an endoscopy, I see there's no mechanical obstruction, and yet the patient is kind of having a loss of appetite and they're losing weight, and this is often in the setting of patients that are demented, and maybe it's not recognized yet, and then we realized, maybe the patient's actually having trouble getting the food to their mouth, but their swallow mechanism is okay. They're not having any maldigestion. They're able to digest the food that they get there, and maybe they're losing weight because they're physically not taking in enough food, and either they're having a cognitive disturbance where they can't communicate that to us, or maybe they're embarrassed, and it's causing them to become depressed and they don't want to talk about it. So that's an instance where I'm like, okay, the swallow's okay. From a medical perspective, there's no obstruction, there's no malabsorption or maldigestion. Maybe I'll get an OT involved to see, can this patient, get the food to their mouth? Is there an issue there with fine motor coordination? So that's something that's always in the back of my mind.
Awesome, which kind of leads me to one of my last questions is like, do you ever receive referrals maybe from us as OTs? Like, they got an OT referral, this is what I should do. Have you ever experienced any of that?
As a gastroenterologist, I get a lot of referrals from like the speech and language pathologist when they're doing an evaluation and they're not really comfortable with allowing the patient to take in, oral nutrition through their mouth. So they'll kind of get me involved to think about placing a feeding tube. I know, some of my colleagues, like in physical medicine and rehabilitation, will get referrals from OTs. And so, but I'll get a lot from the speech pathologist.
Okay. That makes sense. And it sounds like feeding is what you were describing earlier, getting the food to the mouth. That's definitely within our scope of practice and something that OTs work a lot with. So maybe in the future you'll refer more people to OT, or you'll have more experiences with OTs, because it sounds like it's definitely something that is for sure related to what you're doing.
Absolutely, and it's within our scope, and as well as speech language pathologists, it's in their scope. But most people kind of don't see OTs as like a feeding or swallowing specialist, but we are. We actually work. There's a lot of certifications that allow us to work with those patients and clients that need that help in a more functional way. If that makes sense. Yeah.
Okay.
So, if you have any other questions, Becca?
No, I don't think so. Thank you so much for doing this interview.
Oh, my pleasure.
Great.